Here are some of my go-to stretches and exercises to get our most relaxed voice for voice therapy. The first one is a simple head tilt. Sitting up nice and straight, let your one earlobe drop down to your shoulder. I usually walk clients through it and I narrate while they do it as well. Close your eyes and let gravity do the work. I like to tell my clients, visualize that as you're breathing in, you are sending oxygen to the muscles being stretched. And as you exhale, let gravity pull you a little bit deeper into the stretch. And after a few breaths, or about 12 seconds, you raise up to the middle, you drop your other earlobe down to your other shoulder, let gravity do all the work. And again, repeat. You breathe in, sending oxygen to the muscles being stretched. And as you exhale, feel yourself sinking deeper into the stretch. Then you raise your head back up to the center after a few breaths or 12 seconds, and then you drop your chin down to your chest, letting gravity do all of the work. Again, as you breathe in, send oxygen to the muscles being stretched, and as you exhale, feel gravity pull you gently deeper into the stretch. The next exercise we have is called the masseter massage. So your masseter is the biggest, strongest chewing muscle in your jaw. So take your 3 fingers and feel for your cheekbones. Feel for the gap right underneath your cheekbones. That is the top of your masseter muscle near the back of your jaw. It's right there. It's a thick band of muscle. So either using your fingers or the heels of your palms, you're going to start at the top of that muscle, and then you're going to apply pressure and drag down. It's very important that you relax your jaw. It's not an attractive look. Let's do it together. And if you look good doing it, you're doing it wrong. So you drag your heels down your masseter muscle a few times. This is good for people who hold a lot of tension in their jaw, if you're a chronic clencher. And the reason why we are stretching out our jaw as well is because these muscles are connected to these muscles are connected to these muscles. It's like an intricate spider web of muscles. So if there's tension in one spot, there's tension in others. So we want to relax the entire spider web and make sure that our entire vocal system is working as effortlessly as possible to preserve our voice quality. After the masseter massage, we'll do the suprahyoid massage. Your hyoid bone is a U-shaped bone right in the crook of your neck. You can actually grab it and wiggle it around. Maybe don't do that. So your hyoid bone starts here. And so we're targeting the muscles basically under the tongue in this triangle between your hyoid bone and your chin. So you want to take your thumbs and push them up under your tongue. You want this space under here to be really pliable. People who have severe muscle tension, theirs is actually so rigid under there, there's no yield to it. So we want to work those muscles and make sure we're getting them as pliable as possible, get them nice and relaxed. And you do this one for about 30 seconds. Our next one, I call the caveman because you want to protrude or extend your lower jaw in front of your upper teeth. So you stick your jaw out, and then you're going to point your chin to the top corner of the ceiling, and you should feel the stretch down the front side of your neck. And so as I do the stretch, I'll show you where I'm feeling it. Point your chin up to the corner ceiling. This is where I'm feeling my stretch. And so after a few breaths, again, breathing oxygen into the muscles being stretched, and exhale, all the while keeping your jaw protruded. And after about 12 seconds or a few breaths, you relax. And then we're going to do the other side. Extend your jaw, point up to the other corner of the ceiling. And now I feel the stretch down the opposite side of my neck. After a few breaths or about 12 seconds, you release. And then we're going to do the same thing, jaw out. And this time, point our chin straight upwards to stretch out the muscles in the front of our neck. And that's it. Those are my go-to ones. You can also add, if you stand up next to a wall and you put your palm out right in front of you and then rotate yourself away. This one is really good for opening up your chest muscles, helping you disengage your chest muscle so that you almost naturally revert to more diaphragmatic breath support. So this is a good one for clients who are working on disengaging chest muscle involvement when breathing and speaking and transitioning to diaphragmatic breathing. So you do it on one side and then you switch your hand out in front of you and then you rotate away from that shoulder. And the last one I like to do sometimes is the rag doll. Basically, you stand up and you roll your neck and spine down one vertebra at a time and you let gravity do all of the work and then you just dangle. And as you inhale, Breathe to send the oxygen to the muscles being stretched, and as you exhale, sink deeper into that ragdoll stretch. When you're ready to come up from the ragdoll, you roll up one vertebra at a time, and your head is the last thing to come up at the very end. I find that one to be the most relaxing personally, but then it's hard to do any work after. So use with caution. Have fun.